Good morning, everyone. How are you today? Thank you for joining us here at Going Over Town for this very, very important conversation about the COVID vaccine. I decided the best people to bring on board are the experts who can tell us exactly the real deal about the COVID-19 vaccine, the myths, the facts, the fiction. We want to get down to the bottom of it all. So I would like to introduce to you Dr. Tina Carroll Scott, a pediatrician, and Dr. Cheryl Holder, who is the interim director at FIU. Is that true?
I'm not at the Herbert Wertheim College of Medicine. I'm the interim associate dean of diversity, equity, inclusivity, and community initiatives.
Wow, that's about.
I'm telling you, it's a mouthful.
Say that fast at times. And Dr. Tina Carroll Scott, would you please share more about your credentials as well?
Yes, so I'm a general pediatrician, and I am the medical director of the South Miami Children's Clinic. It's a clinic in South Miami that serves primarily African American and Hispanic patients in an underserved area of South Miami.
And you were also behind the pop-up vaccine events, correct?
Yes, okay,
I was. Would you share a little bit about?
Yes. So I was, I've been really disturbed since the vaccine rollouts occurred across our state, initially with the fact that they weren't happening in communities of color that are being disproportionately affected by this virus. And if you looked at the initial rollout, it was happening in the wealthiest zip codes across our state. And I felt like there was a huge issue with not only access, but equity. So even in communities where they did bring the access as far as providing the vaccines, there were additional barriers that prevented the very people who were being disproportionately affected from actually getting the vaccines. And honestly, one of those communities was Overtown. And, I would actually send patients over there to get vaccinated and hear back from my patients about the fact that when they looked at the line, who was there, that they didn't see a lot of people who looked like them. And these are patients of color, Black patients. And also a few of them actually had issues when this was at the very beginning where, the age range was, 65 and over, unless you had a medical note showing that you were high risk and that you were medically vulnerable in order to get vaccinated. And we know that, especially in communities of color, that a lot of residents have comorbidities, whether it's hypertension or obesity or diabetes, that would put them at a higher risk for severe disease if they got infected. And so even though they were coming with doctor's notes, they were being stopped, and some were being told that the doctor's note wasn't valid, and they would call me up, and I'd have to advocate for them to say, no, absolutely, this is a valid note, and they need to be vaccinated. So when I started seeing all of that, I was getting very angry, and I decided that I needed to be the change that I wanted to see. And so I actually I emailed our mayor, Daniela Levine Cava, to tell her that I wanted them to give me vaccines and to make my clinic a pop-up site where I could address all of these things that I was seeing, the access and also these barriers that were being created. And so that's what I did. So the first event that I had was actually March the 20th. And one of the things I had to do was to think outside the box as far as the forms, these medical forms that needed to be signed, because the other issue with people who live in communities of color is that a lot of times they don't have a medical home. So, what we're asking them, we were asking them to do to get this medical, note signed was next to impossible, because, a lot of them hadn't seen a doctor in years and could not get this form signed, but were at high risk. So one of the things I thought about was, how could we get around that barrier? And I decided to do health assessments on site. And this is where Dr. Holder actually came on board, because I reached out to her and I told her what my vision was, that I wanted to be able to include more people and not exclude them. And so I wanted to recruit a bunch of physicians who could actually do these health assessments on site and sign the form, so that, we could vaccinate more people. And part of my vision was that not only did I want to have doctors on site, but I wanted physicians of color, and I specifically wanted Black male physicians who tend to be underrepresented in medicine in general. And I thought, that was really important, especially with the community that I wanted to target. So that's what we did. We did the health assessments on site. I brought the vaccines to the community. And my target was actually 500 vaccines. That's what the county had given me, and we actually went over. So we ended up with the first event vaccinating 648 people at that event. And part of my strategy was targeting Black communities. So not only the community where I work, but I went to Gould, Richmond Heights, Coconut Grove, and I spoke with people on the ground there to get the message out and to say, this is what I'm doing. And, I want to make sure that we get as many people of color at this event. This is why I'm doing this, to make sure that we are protecting our communities.
Thank you very much, actually. And I really appreciate the fact that you were very unapologetic about what your intent was, because that's sort of the context of what we want to talk about today. There are a lot of myths out there. I've heard some of them myself. And, so let's start with this. I learned this morning that 63% of adults have had their first shot. We're on pace, I've been told, and there's been a mad push to be at 70% by July 4th. There's been a lot of talk about herd immunity. First, let's talk about what that is, what that rate should be, and does that change the intensity by which we need to be still incentivizing people and encouraging them to vaccinate? Dr. Cheryl, would you share a little bit about your thoughts on that?
Yeah, well, that 63% can be a little misleading when you look who makes up that 63% in terms of percentage of population. So we know that there's some communities that definitely hasn't made it to 50 or 60% vaccinated. So we do have ways to go. And until we can get the communities that are behind in the percentage up to all of us being at the 70% to 80%, that whole concept of herd immunity is really impossible. So when we talk about herd immunity, I tell folks, think of a big land and think of yourself in a big area, and all the sheep are there congregating together, and the weaker ones will be protected by the stronger ones. Mm-hmm. So if a wolf were to come in to try and pick off one of those weaker ones, enough of the good, strong people would be there to block that wolf from getting that weak sheep. So when we get physiologically to that point, the virus will not be able to find anyone to get in and replicate. Okay. Because when you get infected, you replicate, the virus makes more of itself. And every time it makes more of itself, the chances of it making a really bad actor gets higher. So when we get a lot of people around, when the virus shows up, it's not going to find anyone to get in because there's so many of us that would unlikely get at the weak person. Gotcha. Now, what Dr. Scott was talking about, in the same barriers that we had to getting the vaccines and testing and who got coronavirus, that's why we have to get all communities understanding why they need vaccination so that we can get the protection. Because if you have one group that's not vaccinated and the virus gets into that group and replicates and creates that bad actor, all the other folks over in Aventura and Coral Gables that are vaccinated, that vaccine may not work as well. So then we're back to square one. So it's important that we all get the numbers up in every community.
Are we finally at a point where communities of color have a little bit more access, as you mentioned, Dr. Tina, at the beginning of all of this. And you're right, especially in the state of Florida, we saw a lot of these vaccines go to the wealthier communities. Have we now reached a point where we feel like it's completely across the board and accessible to everyone?
I wouldn't say that we've reached that point yet. I think we have definitely improved as far as access is concerned, and and now that it's wide open. So I mean, as far as you can be basically any age. I mean, 12 years and older. That part of it is better. But I think there still are a lot of barriers, and we had talked about this earlier when we're talking about people who are essential workers, right? Mm-hmm. Where they cannot afford to take off from work and stand in line for an hour or 2 hours, waiting to get vaccinated. So I think we have to get really creative about how we reach those people. I think our mayor is thinking outside the box and trying to do that. Where I know she's even going to hotels and vaccinating hotel workers right where they are. But we need to expand that even further, And I've been talking about this for a while, especially in our Black restaurants, whether it's Red Rooster or House of Mac or, Duckanoo. We need to go directly to the restaurants and offer the vaccines there. And I remember, go ahead.
No, what's been done, I can say that there's some barriers, definitely. And some of the barriers that we see are with jobs. And if you're worried that you're going to get a side effect from a vaccine and you can't work, that's a huge barrier, because who's going to pay those 2 days of missed leave? So these are the concerns that we have to look at. We created a collaboration between the Black nurses, Black physicians, the Haitian American nurses, and the Haitian faith-based network to bring education to 30 churches about coronavirus and testing between October to January, which then primed them hopefully to have a better understanding of coronavirus. And so they'll be ready for the vaccines. So we're now going to do pop-up vaccinations at the churches. We already did the Islamic Center a week ago. We had 78 at the Islamic Center in Miami Gardens. And we're going to go between Miami Gardens, Overtown, and the different vulnerable areas. And that was funded by the Health Foundation of South Florida in collaboration with Miami-Dade County. So there are lots of strategic ways that we're now, the barrier about access in the community, that's coming down. But some of the other barriers are still not there, like full education of why this vaccine is safer based on our current science. So people still need that information.
Well, you tapped on, so in preparation for this today, I kind of went on to the hopkinsmedicine.org site. They have a facts versus fiction page to see what some of those, myths were. What are some of those facts that are out there? I think one of them you just threw out was that the COVID vaccine, there are side effects of this vaccine and it's very dangerous. Go ahead.
I've done a lot of education around this even before I had my, my first pop-up, because I did a survey because I really wanted to see what the thought process was around this virus and the vaccine. And it was interesting because, the majority of the people who responded, the reason, it wasn't that they didn't want the vaccine, but they felt like they did not have enough information, that they did not understand enough about this virus and how the vaccine works for them to make an informed decision. So it was more lack of education, to be honest, than anything else. And so that's what I spent a lot of my time doing. And, I think honestly, we kind of dropped the ball a little bit, especially in communities of color before the vaccine rollout. We should have been doing this months before, before we even, rolled out the vaccine. And now we're playing catch up. And, and I think that part has been really, really difficult, to do that simultaneously when there's an urgency, because we have this raging pandemic that is, that's killing people every day, to try to get people on board with, with taking this.
Yeah, that's why these programs are so important to get the message out. We do a series of webinars, the Black nurses, that whole collaborative that we call Keeping the Faith. And we've done it on Zoom, but the same issues, the same population, they don't have the bandwidth. I mean, there's no broadband in Liberty City. So
Correct.
Yeah.
Exactly.
that makes it
So access
harder.
to this.
Yeah,
Yeah.
so that's
And
where we don't have the county stepping up enough, and it's starting to use a different way of reaching. So radio, trusted messengers, and that's why the
yes.
Black nurses and the Black physicians, we're out there. They get a card when they come and get tested with us that gives the nurse access. So there's strategies that can be used that we as a community, the ministers, we got to get them blaring the science, blaring the
Yeah.
understanding, because people
And,
make the right
and
decision.
Stephanie, so what I tell them too, as far as side effects, I tell them that's exactly what you want. Okay. You want the muscle pain and the fever and the body aches, because that's exactly what you are supposed to experience to show that your immune system is doing exactly what it's supposed to do to protect you in the event that you are exposed to the real thing, the SARS-CoV-2 virus that causes, COVID. So, none of that is bad. And it's short-lived. Okay. Usually like you're fine within 24 to 48 hours and that's it, So, I mean, that's not something that we should be fearing. And, and in fact, I tell people after my first vaccine, I had nothing. I mean, maybe a little bit of arm soreness, and I was concerned, like, I mean, did I actually
That's
get
part
it?
of our
And
age,
I wanted to feel something.
Yeah.
I wanted to make sure that my immune system, was intact and doing what it was supposed to do. And with the second vaccine, yeah, it knocked me out. For 24 hours, I had fever, I had chills, I had, the body aches, the whole 9 yards. But I was joyful. I was like, okay, my immune system is working, I'm making some serious antibodies and I'm ready, So that's kind of the message that, that I've been telling people. Don't worry about
you
that.
can work through it, which is what I tell folks.
Exactly.
That you're not going to be, most people are not knocked out. A Tylenol after this, you'll be able to get up, younger, older, because that's their fear. Will I be knocked out for a few days and lose my job or
My
lose
income? Yes, exactly.
And I'm like, no, you're not going to lose the day of pay. But we give here's a number, call us, we'll walk you through this. You can get through this with the vaccine. And most people do great.
And they're fine. Yeah,
and they're fine. Good. So that's the message that we want to get through.
No, and I tell them too, if you actually get the virus, you could be out a lot longer.
Exactly.
So
you're going to
that's
lose
what
your
you're
job.
weighing. Exactly.
You're going to
I tell
lose
my
your job.
students that, you got exams like the college kids, you got exams coming up. If you're an athlete, you have to be top performance. If you end up with this virus and get weak for 3 weeks, how are you going to do well on those tests? How are you going to go do your sports? So
you tapped on something there. The young people, I don't think young adults really feel like, and I blame, let me go back and give a little blame here. The government, in terms of when COVID first started, the marketing, again, I understand we didn't know what we were dealing with, but we immediately put out that it was about older people.
Yep.
So it's been very hard to get young people back on the bandwagon to understand that they too can die from this. And they too can be a carrier of this. So let's dispel that myth that young people feel they can't get it or they can't carry it, so therefore they don't need to have the vaccine. Can we talk about the importance of, and Dr. Holder, since you work with young people, go ahead and continue.
Yeah, what I tell them, it is true, and most of the myths and things come from some truth. So yes, most young people will do better with this infection, but what is better? And you don't know, when we say young people, that's hundreds of people. I don't know for you, the person I'm looking at, I don't know how you're going to do. So are you going to be the one who end up with the heart disease? Are you going to be the one with the stroke? Are you going to be the one with what we call the long hauler syndrome, where your brain isn't quite there and you feel weak? And you're only 20. What if you're the one that's selected for that? Yes, the population will do better, but individually, I can't tell you if you're not going to be the one. I have a vaccine that will make sure that you are not the one that will end up being sick. So when I look at the risk and the benefits, I'm like, it's clear to me that you want to take a chance saying that, oh yeah, young people do well, and you turn out not to be that young person who does well, over taking a vaccine that has the same thing like the infection, but less side effects, less
Mm.
long-term complications, less everything, and you will do okay. So yes, young people, when you think about it, you will probably make it through and not die, but that's a whole hundreds of people. I don't know for you. So I encourage them, especially those who have some big responsibilities. You have families to take care of. You live near your grandma or your auntie and the older people. You have a huge
Yes.
responsibility to keep yourself well. And the
Right.
only way, the best decision in keeping yourself well because of your responsibilities is to choose the vaccine.
Well,
And
Dr.
and,
Hill,
and
you serve a younger audience.
yeah.
You're more talking to their parents, not
Yeah, she's
them.
parents.
So, what's your conversation like with talking to the parents of this younger audience to say just because they're young doesn't mean they don't need to be considered as well?
No, I'm gonna piggyback a little bit on what Dr. Holder said, and when she was, talking about, herd immunity. So, and what's happening is that if you look at the percentage of older individuals who are fully vaccinated, it's a pretty high percentage, right? So the virus has to have somewhere to go, right?
Mhm.
And so, at that point, it's going to start going to the younger population. And so we're seeing that, even in our youngest of kids, where, yes, it's true that kids do well overall as far as, not being hospitalized at the same rate or dying, but it doesn't mean that they are, completely being unaffected by this. And we've actually seen an uptick. So I want to say it's over 20% of kids now are making up, the new infections that we're seeing. And we are seeing kids who are being hospitalized with this multi-system inflammatory syndrome in children, where they can get really sick and they're in the ICU and on multiple medications. So they're not immune by any stretch of the imagination. And, and what Dr. Holder talked to as well, as far as the long hauler symptoms, we're seeing that in children as well. And so, I mean, and so we're looking at this and saying, honestly, I mean, even if you have mild infection, we don't know fully what the long-term consequences of even, a mild or asymptomatic infection will be down the road. So everyone has to do their risk, benefit analysis and, and decide, which is worse, okay? Taking a theoretical chance, okay, on a well-researched vaccine, okay, based in science, we have the data, versus the true unknown of this virus that just came onto our radar a year and a half ago. And yes, we know a lot more than we did a year and a half ago as far as how to treat patients in the hospital. That's true, okay, but there's still so much more that we don't know, and there's a randomness and unpredictability with this virus, and it's like every time we feel like we have a good handle on how it's going to act, who it's going to infect, it throws us for a loop and does something completely different, and and I also tell parents, if you look at what's happening now in India, in areas of Brazil, who thought they were good. Oh, they had herd immunity the first go around, and whoever died off, and the ones who survived, they're good and protected, and they're being devastated right now, okay, with these variants that are reinfecting people and and killing them. So this isn't over until it's over. And the sooner we get as many people on board, and I don't know what that number is, honestly. I don't think anybody can tell you what that number is, to achieve herd immunity. All I know is that we need to get as many people as possible vaccinated. I mean, and that's it, because the longer we have people sitting on the fence and we give this virus a chance to infect someone and replicate and and change, then the longer we're going to continue with this pandemic. And the people who are vaccinated, as Dr. Holder said, are not going to be protected either, because eventually even our vaccines may not be effective. And that's the danger. That's really what the danger is.
What I hear?
So I'm going to go through a quick rapid fire question, because we were trying to make sure we keep it within a certain time frame, but just quick true or false. The COVID-19 vaccine affects women's fertility.
False.
If you already have COVID-19, you don't need the vaccine.
False.
False. That's interesting that you do need it, but you can probably wait a little bit. When the supplies were really big, there's a problem with supplies. we had them because their body had made enough fighting antibodies. So
Gotcha.
for a while, it protected them, but that we know wears off. So we say within the 3 months of your infection, get a vaccine. And
I
not
had
every
the antibodies, so that
Yes,
was
and also with
doesn't
with, with
last.
with with the natural immunity, it's a variable immunity. Okay, so
Right.
we really don't know how protective it is long term,
Yeah.
which is why it is better to get the vaccine. Okay, induced
I had
immunity.
the antibodies, but
Yes,
immediately I was like, I'm going to do it. I wasn't going to be the first person to do it, but I did do it.
yes,
Getting the vaccine means I can dispense with CDC recommendations, so I no longer have to wear masks and I don't have to social distance.
false to a certain extent. Yeah,
Because,
false.
if you're
Yeah.
around other people that are
People
all
who are
vaccinated,
vaccinated. Yeah.
then
Okay.
you're safe. But I don't know how you're going to know that because I don't have a badge or something. I don't walk around with my card.
Right.
So
Right.
I follow the directions. I do just like HIV. I tell everybody when I come to draw your blood, I have gloves on.
Right, exactly.
You don't bother me that I have my gloves on. I don't know what's in you. I
So-
assume you're all negative, but I put on my gloves. And
Right.
you wouldn't expect me to draw blood in you without wearing gloves.
Yeah.
So
Exactly.
I don't know what you're having. So if I'm not around people, like my whole family's vaccinated. So when we're together, we don't wear masks in our house because we know that's what the CDC
Right.
says. But once I get out there with the general public, all bets are off. I
Right.
don't trust them. And
Yeah,
I'm
we're not
like,
we're not quite there yet, Stephanie.
we're not there.
No.
Please
And that's
put your
less
mask.
stress. Keep your stress level down.
Yes.
Just assume everybody's infected when you're out
Yes.
there and just put on your mask and be relaxed. Chill out
Yeah.
by putting your mask on. Don't trust everybody.
So this one I thought was interesting. COVID vaccine enters your cells and changes your DNA.
False. Big false. Yeah.
Um,
It doesn't, no, it doesn't even enter, the part of the cell that contains your DNA, which is the nucleus. So that is absolutely
Yeah, see, it enters the cell.
yes.
Yeah, see,
And it
that's
stays
what
in
we
the,
say.
like, a
There
part of
is
the
some
cell. Yeah.
truth to everything.
Yes.
It
Yes.
does enter the cell, but not the part with the DNA.
The DNA.
So
Yeah.
that's the little tricky part in the
Yes.
information that's out there.
Yeah.
They take it and then they flip it a little bit. But
Yeah.
no, it doesn't mess with your DNA.
So if each one of you would give sort of a final statement, first of all, I would say, to our community, because, we're all Black women here. We know we've heard a lot that is going on. And me, Black educated woman, I will say I was a little skeptical at first, but I decided it was a better way to go than to risk what was going on the back end. If you'll share a message to our community and the quote unquote 30% on the back end, or those folks who may not even be on the fence and are saying infinitively, I'm not going to do this. What is your message to them about what's important with this vaccine? Dr. Holder, Dr.
Yeah.
I keep calling you Dr. Cheryl, Dr. Holder. I hope it's okay.
That's okay,
But I
Dr.
really feel
Cheryl.
the
Dr. Cheryl is fine. I understand the fear. It's natural, it's normal, it's healthy. I tell all my patients when I'm giving you something new, I want you to have a little questions. I want you to ask me the background information, whether it's a Tylenol or it's a vaccine. This is all very healthy. But then I need the openness and then the understanding when I share the information of the risk, of the benefits, and what is our alternatives so we can work together to come up with the best decision for you and your family. Right now in this emergency, it is clear to me and most scientists and most doctors and everyone out there, and what we see where the people who got vaccinated are doing better and are not in our hospitals, and the folks who aren't. So I think it's clear right now that the evidence is showing that being vaccinated is a whole lot safer and better for you and for your community. And it will bring us to the point where we can get back to the new normal, which will be protecting our health and staying well. So think about it, healthy to be a little bit questioning, but take that information and process it with our help, with anybody. Call us, call the doctor, call the health department, talk to your family and friends, and process it so you can understand why it's safer for you to get vaccinated, to protect your health and protect your family.
Okay. Dr. Tina?
Yeah, I totally agree with all of that. And like Dr. Holder said, I too was distrustful at the very beginning, and I was not on board with this. But I had to, I didn't know a lot about the mRNA technology, and even as a physician, I had to educate myself and to feel comfortable that that this was safe. And that there weren't going to be any long-term effects. And once I did that and I educated myself properly, then I was 100% on board with taking this, not only for myself, but giving it to all three of my daughters. I have a 23-year-old, an 18-year-old, and a 15-year-old who just got her first vaccine 3 weeks ago and is getting her second one on Saturday at an event that I'm holding at my clinic. And I think, what I would say to the Black community is that, yes, we do have to acknowledge the history of medical experimentation and exploitation and racial health disparities that exist to this day. All of that is a fact. And I mean, we cannot ignore that. But as I mentioned before, we're in the middle of a raging pandemic and we have to pivot now, right? And we have to look at what the reality is of what's happening in our communities that are being devastated by this virus. And we need to be careful about where we're getting our information, okay? Social media, it's a blessing and a curse, okay? And I really think people should be going to the trusted messengers in their communities, whether it's physicians or pastors or community leaders, whoever it is that they trust and admire that is able to relay this information properly. That's where they should be going. And I feel like when you empower people and they understand not only what their role is in protecting themselves, but their families and the community at large, that's when we finally end this pandemic. Right. So.
And we hope we are one of those trusted messengers. Yeah. And that's why we invited these wonderful ladies here to, as I mentioned, get to the difference between fact and fiction. We hope this has been a great experience, a learning experience. We want people to make informed decisions. We don't tell you what to do, but we hope at least the decisions you make are informed and not just based on perceptions, history, politics. I think we talked about earlier that we're fearful of taking the steps we need to do to save our lives. So I would love to invite you ladies back again another day because I'm pretty sure more myths will arise as we go through this process. I want to thank you both so much, Dr. Tina Carroll Scott.
Thank you.
Dr. Holder for joining me today so that we could get this information out there. I would like to thank our sponsors and our partners, the Urban Health Partnership, the Health Foundation of South Florida, the Overtown Children and Youth Coalition, and the Overtown Youth Center. Thank you. We'll see you back here again on Tuesday at 10 o'clock with one of our local residents who vaccinated and wants to share his story, Andre Williams. And we'll see if we can get some other people to join in to share their experience. Thank you, everyone.
Thank you, Stephanie.